Okay, good afternoon. Welcome to lecture series, Global Development Agenda and Thailand Challenges. Today, I am going to talk about global health and development. My name is Yasushi Negishi, lecturer at Puey Ungphakorn School of Development Studies, Thammasat University. Let me introduce myself briefly. After graduating bachelor program in economics from Japan's Hitotsubashi University and master's program in international development economics at USA Yale University. I was trained as an economist and have spent almost 40 years in development finance space by serving many roles such as country director's position in Thailand and Lao PDR with the Asian Development Bank from 2013 to 2020, Senior Advisor Equity Department with IFC from 2009 to 2013, and also Chief Representative's position in Washington, D.C. and in Bangkok at the Japan Bank for International Cooperation from 2003 to 2009. During these years, I followed up macroeconomic situations of both developed and developing countries and was involved with development projects such as infrastructure provision, social sector service delivery, and financial sector development. I am looking forward to sharing my view and exchange opinions with you going forward. With that, let me start my today's presentation. These are the 5 presentations that I have been delivering under the series. As I explained in the first presentation, I prepared these lectures for those who are interested in learning on global development agenda at the introductory level. I hope this presentation will help learners to familiarize themselves with key development issues. Today, I am going to talk on global health and development as a third topic in the series. As I concluded in the previous presentation, poverty reduction and reducing inequality are 2 major development agenda. And it is important to secure access to health care services, not only for those who are under poverty line, but also those who would like to improve their quality of life. Today, we have 3 sections. We start with definition of global health, followed by primary healthcare and universal health coverage section. And finally, we talk about global and Thailand's health challenges. First, on the definition of global health. Global health is defined as a field that focuses on improving health and achieving equity in health for all people worldwide. I believe there are 2 aspects, background, which support global health's approach. First one is from a human rights perspective. In 1948, UN General Assembly proclaimed so-called Universal Declaration of Human Rights. This is a document officially recorded the rights and freedoms of all human beings. Section 25 in that document says, everyone has a right to a standard of living adequate for the health and well-being of himself and of his family. So based on the declaration, health is a foundation to live a dignified life. Another aspect is from a human capital theory perspective. Being healthy has a positive impact on income from this theory. So based on the theory, improvements in the population's health reduce poverty in the countries. So I believe these perspectives support the initiatives of the global health. Next, I would like to talk on the what are the tasks of global health. First is to understand disparities between developed and developed countries. Developed nations often have robust healthcare systems, lower disease burdens, and longer life expectancies. In contrast, developing countries struggle with inadequate healthcare infrastructure, higher rates of infectious diseases, and greater maternal and child mortality. Therefore, understanding this disparity is essential for forming effective strategy to improve health outcome worldwide. Another critical disparities of global health lies in the contrast between urban and rural areas within countries. Urban centers typically have better access to healthcare facilities, education, and economic opportunities. Therefore, we have improved health indicators in urban areas. Meanwhile, rural areas often face significant challenges in accessing healthcare, clean water sanitation, and education. This urban-rural divide underscores the need to address disparities within nations. We can measure the discrepancies, these indicators, which I mentioned in the first presentation, such as infant mortality rate, maternal mortality rate, life expectancy, access to healthcare facilities, distribution of healthcare workers, and etc. And assessing the disparity of health outcome is key to global development. When we recall our recent experiences from the COVID-19 pandemic. This graph on infant mortality rates for world 3 income categories, such as low income, middle income, and high income countries, and Thailand's cases. The time period this graph covers from 1990 up to year 2020, and infant mortality rate means how many babies die before they reach 1 year old per 1,000 live births. As you can see, world infant mortality rate were reduced by more than 50% during the past 30 years. However, there are still large gaps between those of low and middle income countries and high income countries. And this is one apparent example that we have to work to reduce the discrepancy with the international cooperation. This second graph is a graph on life expectancy at birth for the world 3 income categories and Thailand's case. The time period is the same as the last one, start from 1990 to year 2020. Life expectancy is how many years those newly born babies are expected to live given the current death rate. And as you can see, world life expectancy increased from 65 years old in 1990 up to 73 years old in 2020. We have a significant progress. However, there are still large gaps between those of low and middle income countries and high income countries. So we also need to work on to reduce the gaps between those low and middle income countries and high income countries. As for Thailand's life expectancy, Thailand has been successfully lengthened the life expectancy during the past 30 years. So in 1990, life expectancy in Thailand was 70 years old, but currently it increased up to late 70s. So Thailand has been successful, and Thailand's life expectancy is close to those of the high-income countries. Okay, next, let me go to the second section, which is primary healthcare and universal health coverage. Primary healthcare and universal health coverage are two main approaches to improve healthcare delivery within countries. And as for primary healthcare, we will learn why it is considered a fundamental approach to healthcare delivery and historical development of PHC in Thailand. And as for universal health coverage, we will also learn why it is critical for ensuring equitable access to healthcare services, and also which components of UHC should be further strengthened in Thailand. Let me briefly explain the background of PHC, primary healthcare. Before primary healthcare approach introduced, healthcare systems focused mainly on hospitals and specialized care. However, this approach could not address the health needs of the rural communities. Therefore, PHC sought to improve the needs by placing emphasis on prevention, early intervention, and community-based care. And PHC covers a wide range of health services that are accessible, community-based, and focused on prevention, education, treatment, and rehabilitation. Let me also add that there is a Almata declaration with regards to the background of PHC. And in 1978, the WHO and the UNICEF jointly organized international conference on PHC in Almaty, Kazakhstan. Since then, PHC was widely recognized as an effective approach for healthcare delivery. This pyramid indicates that there are 3 layers of healthcare delivery. From the top, tertiary healthcare, secondary healthcare, and primary healthcare. In the past, we focused on tertiary healthcare, which is for highly specialized care provided by regional hospitals and general hospitals. And the secondary healthcare for advanced care, which was provided by community hospitals. And PHC approach is to cover the health needs of the lower part of the pyramid and provide basic healthcare services through rural health centers. So this is the new addition to the previous 2 layers. And primary healthcare is designed to meet the health needs of the individuals and communities at the most fundamental level. And PHC includes a wide range of health services that are accessible, community-based, focused on prevention, education, treatment, and rehabilitations. So that's the concept of the PHC. And let's look at how PHC was installed in Thailand society. This is a graph quoted from the research paper. I footnoted the name of the paper at the bottom of the slide. And on the left-hand side, we have 4 bar charts starting from 1977 to up to 2010. And by these 4 bar charts, we can understand how Thailand was able to install PHC during the past 30 years. So Thailand introduced primary healthcare policy and number of outpatient visits to rural health centers and community hospitals increased more than that of the regional and general hospitals. So in year 1977, 46% comprised by the patient visit to regional and general hospital, 24% to secondary health care services provided by community hospital, and 29% handled by the rural healthcare centers. However, as time goes by, the share of this outpatient visit to each layer of the hospitals have changed. So by the year 2010, we have the bar chart which look like a pyramid shape. So only 12% outpatient visits are recorded by regional and general hospital, 33% by community hospital, and 54% were handled by rural health centers. So by introducing and strengthening the primary healthcare layer, Thailand has been successfully implemented in this PHC during the past 30 years. And I just wanted to add that Thailand's village health volunteer program, which was started in 1970s, improved access to healthcare in rural areas. And this program is often cited as a model for community-based primary healthcare worldwide. So in order to implement PHC, Thailand also implemented this village health volunteer program, and which seems to be a quite functioning approach to strengthen the PHC in Thailand. Okay, next, let me explain about the universal health coverage. As for the background, after the World War II, many nations participated in the World War II. Now their infrastructure were devastated. And those nations were considered how to deliver essential health services to all the citizens. And fortunately, world economy started to recover after the war, and the developed countries' governments gained resources to finance people's welfare. So starting in late 1960s and 70s, many developed nations started to this new policy called universal health coverage. And universal health coverage systems are designed to provide healthcare services to all residents, regardless of their ability to pay. And UHC has been adopted by many developing countries as well. And the current SDGs include achieving UHC as one of the targets under the goal 3, good health and well-being. So that's the overall background of the UHC. And let me explain the outline, further outline of the UHC with the healthcare delivery pyramids. Yeah, universal health coverage is a fundamental concept in global health that is to ensure that all individuals and communities have access to the healthcare services they need without suffering from financial hardship. That's the approach of UHC. And UHC aims to provide equitable access to essential healthcare services, including prevention, promotion, treatment, rehabilitation, and palliative, meaning end-of-life care for all individuals and communities, and no one being left behind. So this is the concept how UHC is trying to achieve. We have already learned that there are 3 layers of healthcare deliveries, but the idea is government should provide financial assistance to all the individuals and communities so that all the citizens can receive such healthcare services, all the healthcare services they need without suffering from the financial burdens. So this is the second approach which each country has been trying to achieve since the World War II, and many developed countries has already achieved the UHC. This is the world map indicating how much percentages of the population are covered by health insurance, national health insurance, and private health insurance, and so on. And as you can see, this map, many developed countries, Europeans, Asians, and also North Americans are already, and also Australian and New Zealand are covered by UHC. However, there are countries, yellow color or orange colors, light green colors, those coverages are still under around below 60, 40, 20%. And in the case of Thailand, Thailand has been successfully introducing this universal healthcare coverage. This is a pie graph published by the Thailand's National Health Security Office. And according to this graph, 99.9% of Thailand's population are covered by health insurance schemes. So in terms of the access or coverage, Thailand also has been successfully implemented this universal health coverage. But at the same time, UHC also seeks to improve the quality of healthcare supplies, healthcare deliveries. So if we look at the reality of Thailand's healthcare delivery, some people argue that in case of Thailand, we have only limited quality of healthcare and long waiting time for patients in public hospitals. And that's number one. Number two, we are still lack of healthcare workers and facilities, in particular in rural areas. And number three, lack of transparency in the system and patients' lack of knowledge, which services they are entitled to. So these are the 3 points that some people still arguing that these are the still weaknesses that the Thailand still need to work on about UHC. Okay, let me go to the third section, final section, which is both global and Thailand's health challenges. And this slide is to compare the targets, goals under the MDGs and SDGs. Among the MDGs, which was agreed in year 2000 by UN, they set 8 specific targets. And out of 8 targets, there were 3 health-related targets. First one is reduce child mortality. Second is improve maternal health. And the 6th is combat HIV/AIDS, malaria, and other diseases. And SDGs was agreed in year 2015 by UN, which are supposed to succeed MDGs. And under the SDGs, we have one target, goal 3, which are called good health and well-beings. And among 17 goals, all health-related targets are under the goal 3. And when we look at the each targets under the SDG goal 3, there are 9 specific targets. And if you check these 9 targets, first 3 are inherited from the MDGs, 3 goals: reduce maternal mortality, reduce child mortality, and end the epidemic of tuberculosis and malaria and etc. So under the SDG goal 3, we inherited the previous 3 goals. And in addition, we have additional 6 targets. First is reduce premature mortality from non-communicable diseases. Number 5, strengthen the prevention and also treatment of substance abuse. Number 6, halves the number of deaths and injuries from road accidents. Number 7, universal access to sexual and reproductive health care and services. And number 8 is achieving UHC. And number 9 is reduce the number of deaths, illnesses from hazardous chemicals and airs and etc. So these are the 9 specific targets that the global community is trying to achieve under the SDG goal 3, good health and well-beings. And these are the health outcomes that we are going to achieve. UN is trying to achieve by year 2030s. But as we understand from our previous experience of the COVID-19 pandemic, I believe that we also need to work on global health governance issues. during the pandemic, WHO tried to communicate and also announce measures to deal with the pandemic situation. However, there are many issues. How to design this governance structures. In addition to these health outcome deliveries, I believe that the global community needs to work on how to redesign the governance structure of the global health. Okay, let me move on to Thailand's challenges. I just want to compare the SDG 3 targets and also the current data of Thailand's this data by causes, illnesses. As for target number 3 of SDG goal 3, ending the epidemics of AIDS, tuberculosis, and malaria. As for the Thailand numbers, 17% of the people died from infectious diseases. So Thailand also need to continue to work on this issue. Another target is number 4, which is reduce the premature death from non-communicable diseases. As for the number of the percentage of the people died from non-communicable diseases, which is currently 52% of the total deaths in Thailand. And according to other research papers, many researchers pointed out that Thailand's needed to work to reduce the number of deaths from non-communicable diseases, because we are not only losing people, aged people from aged population. There are many middle-aged deaths from caused by non-communicable diseases. So this is another area that the Thailand's need to work on in order to sustain or in order to maintain the health of the middle-aged people in Thailand. That way, we can maintain the very scarce human capital in Thailand, precious human capital in Thailand. That's number 2. Number 3 is target number 6. Halve the number of deaths and injuries from road accidents. In terms of the Thailand cases, 4% of those passed away are caused by transport accidents. And we know that Thailand's number of deaths caused by traffic accident is still very high. And apparently, those people died from transport accident considered to be a middle-aged or younger people. And again, those are very precious human capital in Thailand. So I believe this is areas that Thailand still need to work on. And apparently this is a Thailand's challenges that we have to conquer. And finally, targets number 8, achieving universal health coverage. As I mentioned in the previous slide, there are many remaining issues to improve in Thailand's when Thailand's achieving universal health coverage, especially on the quality side of the health care services. And I believe these are the at least four main issues that Thailand still needs to work on. Of course, there are still many issues Thailand needs to work on, such as how to treat those people suffered from substance abuses, and also certainly we need to improve the universal access for reproductive healthcare service and so on. And we also have the PM 2.0 issue, which are related with target number 9. So yeah, I would say in most targets, Thailand's health authorities continue to work on, but I just want to raise those 4 points by reading these statistics. So with that, let me finish my today's presentation. And if you have any comments and questions, please send me those comments and questions either in the Facebook or YouTube. And I'm really looking forward exchanging opinions with you going forward. Thank you very much for your attention today.
Ajarn Yasushi หลุด Hello อาจารย์ Yasushi
Yes.
อาจารย์มีอะไรหรอเสร็จแล้วเนาะ
Are you finished?
Yes. Sorry, it's only 40 minutes.